lot of people, you know, they get the first test and they you know, and it's not conclusive.
Right.
And but for you to go one step further, I think is noteworthy, to make sure that the diagnosis is complete.
Right.
Okay, because there are other areas that they could have sicknesses, and I know you do the monitoring, but there's something called anemia.
Right, right, right. Well, the patients, just to go, let's take a step back and then we'll move forward.
Right.
Patients come to me, they're referred by other physicians because they have secondary or tertiary infections, in which we're going to get into right now, and by word of mouth.
Right.
Because of my reputation in the community throughout the show and all the outreaches we have done. I have individuals from the Bronx coming down to see me in Brooklyn. I am located deep in Brooklyn. I am in Bergen Beach, so that's pretty far. Right. So that's how far my reputation is extended. That's how far I am able to leave and people are following.
Well, somebody's they want treatment.
Yes.
Sometimes and then it's the kind of treatment. Now,
yes.
You're not going to speak about yourself, but what they tell me is that he sits you down, he calms you down, allows you to get a good understanding of his diagnosis. Does not take a shot and you're out of here. It's monitoring, letting you know that he's available. A number of things that physicians just don't do anymore. And it's a caring kind of treatment. And that has sent signals to, especially people who have HIV, AIDS, or HIV. They are scared. They are ostracized. Maybe their family members don't want to even talk to them. But to have a doctor that can give them the respect that they deserve is noteworthy, and I want to thank you for that. And that's a lot of reasons why they come from the Bronx to Brooklyn.
That's true. Thank you for the compliment, but it's true. I treat every patient as if they're my family. A lot of patients will make a comment that, wow, I never had a physical like that before. I'm like, well, what type of physical have you had? This is the proper way to do a physical.
Right.
Also, I touch my patients. I'm hands-on. You know, I'll give them a hug. You know, if they're down, I'll give them a hug. I'll shake their hand. I don't wear gloves. You know, other doctors, I've heard stories where they don't touch their patients. They don't stand up from behind the desk. They're right, I know.
Yeah.
They barely make eye contact with their patients, or if they do touch the patients, they're wearing gloves. I said, that's not how you contract HIV, and that's definitely not how you're going to develop a relationship with your patient.
That's a scary physician, boy.
Well, that's a common situation.
Yeah.
That I'm being told. I said,
Right.
That's pretty sad, because you're not going to contract it. You have to really touch. Yeah, I always say look, listen, and learn. You know, and look, listen, and feel, just like CPR. You're going to look at the patient, you're going to listen to the patient, you're going to touch the patient, you're going to touch the patient emotionally and physically. That's the only way you're going to get to know your patient, be able to treat them with quality care, and you're going to get good response.
Okay, now
let's get right into this.
Now we're down to that word that I've been struggling with.
Yes, anemia.
Okay, anemia is pretty easy.
Yes,
All right, well, tell us what that is quickly,
Okay,
and then we're
sure.
going to go to the other one, which I'm still trying, thrombocytopenia.
Yeah, we're going to go through
Too
everything.
bad. I'm not going to try it again, though.
We'll do that.
Okay. Yeah.
I have patients, like I said, that come to me and they have secondary or tertiary infections,
Right.
and they come with what we call anemia. Anemia is when we have either low red blood cell count or a hemoglobin count, which is below normal. They will have symptoms of fatigue and feeling cold, and they, maybe some shortness of breath, and they just don't know why. And what I do is a routine CBC with a differential, meaning I will break it down into the subcategories, and I will look at the blood work, and we'll take, I'll have numbers because it's measured, and I will know if they have anemia or not. Now, anemia, you've heard anemia before. You've heard of sickle cell anemia,
Yeah.
right? They have macro and microcytic anemia. Macro is large, where you have a B12 or folic acid deficiency. Microcytic anemia would be iron deficiency. You have Cooley's anemia. There's several anemias out there. So when I look at the differential, I'll break it down. I'll determine what type of anemia they have, and then we treat that.
Now to the word that I've been struggling with. I'm going to try thrombocytopenia.
That's it. Excellent.
I did it. Okay.
That's it. Yes.
I won a contest for it.
Yes. Well, one of the other secondary diseases, or medical condition, we should say, is thrombocytopenia. All right. That sounds like a fancy term, thrombocytopenia. Well, what it means is platelets. We're looking at the platelets, and we look at the platelet count. Platelets, you will know, maybe not by the term, but if you ever cut yourself, which all of us have cut ourselves, we need to form a clot. Well, how do you form a clot? We need platelets, and there's a whole cascade to form a clot. Well, we need those platelets. With patients who are immunodeficient, and they're taking very toxic medications, because the HIV medications are very toxic. They could have had chemotherapy. I have 2 patients who have cancer. Like I said, there's secondary diseases that are associated with HIV, and they've received chemotherapy, which really depletes their immune system, and that really depletes the bone marrow, and the platelets come from the bone marrow. And so I need to stimulate the bone marrow to produce more platelets. Without platelets, you can have a bleed, you can have a stroke, you raise your blood pressure and the artery ruptures, and that's what we call a hemorrhagic stroke, and we need those platelets to stop. It doesn't have to be in the brain, it doesn't have to be that significant. It could be just what we call micro tears from everyday activities, and you need the platelets to, to clot. I just want to, because we're talking about the thrombocytopenia and the platelets, well, there's a connection between the kidney and the bone marrow. And they're like, well, what is the kidney and the bone marrow? They're not even really, how are they related?
That's right. Yeah.
Well, there's different parts of the body. So, well, they are related, okay? And they're related through hormones, okay?
Oh, yeah?
Hormone. Well, a hormone's produced by the kidney.
Yeah.
And the kidney sends that hormone to the bone marrow. The bone marrow responds. And it's called epigen. The epigen is produced, kidney releases, gets sent out because there's a feedback mechanism, and it sends that hormone to the bone marrow. The bone marrow gets stimulated to start producing more cell types.
Right. Now, you've seen patients come in, and they've been in this kind of, a deficient condition.
Yes.
And in your treatment to them, how have they been responding on an average?
Overall, we've had good success.
Very good.
Yeah, I've been very fortunate because of the type of medications that I'm using and the compliance.
Yeah.
And the compliance is a huge factor. The medications and the education, I give them the education so they could feel comfortable and they're in control. And when they're in control, when the patient's in control, they become more compliant. They'll show up for their office visits, and they'll follow medical instructions, and the outcome is much better.
Oh, I see what you mean. Well, okay, what about neutropenia?
Yes, neutropenia, okay? Let's go back to the CBC that I spoke about earlier. The CBC, complete blood count, that's what CBC. So if you've heard, or your doctor or the nurse or on some media, they say, oh, CBC. CBC means complete blood count. And I order a complete blood count, CBC, with differential, meaning I'll break it down into the subcategories. Now, I look at the neutrophils. The neutrophils, I need the neutrophils. This is how I explain it to my patients to make it really easy. We have an army, and that's your white blood cells. And then within your army, you have soldiers. The soldiers are your neutrophils. So in order to have a strong army, we must have a lot of soldiers. Now, we know about that because we're both military. You're retired,
exactly.
A Harlem Hellfire, right? I'm with the New York Guard, so we understand a strong army, you have to have a lot of soldiers. Well, it's the same thing with the immune system. We have to have a strong army with a lot of soldiers, and we're at war. We're at war with infection, bacteria, and virus. That's what we need to have, a strong immune system, okay? That's your army. So with the neutrophils is one of the main characters, soldiers, that fight against infection, specifically bacteria. So what I do is I measure the neutrophils. If the neutrophils are low, then we need to increase the number of soldiers so we have a stronger army, which the white blood cell count will start to increase, and then we're able to fight infection. Because with HIV, it's all about suppressing the virus so we can have a strong immune system so we can fight off a simple infection. Because a simple infection, for you and I, a common cold, just a runny nose, can make a world of difference where a individual who is HIV positive with a very low immune system, they have a very weak army, a very low number of soldiers, can put them in a hospital and they can end up with a pneumonia and die.
Just a cold? Or...
Just a common cold.
Right.
Yeah, that's how significant the army, our white blood cell count, and the immune system is. It's that powerful.
Mm-hmm.
So what I do is, like I said, I order a CBC with the differential, and I will look at the breakdown. I'm going to look at the hemoglobin, because I'm looking to see if there's any anemia. I'm looking at the platelet count. I want to see if there's any thrombocytopenia there. And I'm also looking to see if there's neutropenia, and that is the neutrophil count. I must have normal levels. When you have normal levels, then I mean your immune system is fairly strong, relatively speaking. But if I can drive them with the medication into the normal range, then we reduce the risk for these secondary infections.
Right. Now,